Is post-colposcopy bleeding or cramping normal for cervical screening? Have you ever wondered if it's normal to experience bleeding or cramping after a colposcopy? Many people do, and the good news is that mild bleeding and cramping are common after this procedure. Colposcopy is a cervical screening method that allows healthcare providers to take a closer look at the cervix and identify any abnormalities. After the procedure, it is typical to experience some light vaginal bleeding or spotting. This bleeding can vary in color, appearing brown, pink, or bright red, and usually lasts from a day or two up to about a week. If a biopsy or treatment was performed during the colposcopy, you might notice that bleeding can last longer, sometimes up to 2 to 4 weeks. The flow may resemble a moderate menstrual period. Mild cramps similar to menstrual cramps are also common and may persist for about 24 hours or slightly longer after treatment. You may also notice a watery or brownish discharge following the procedure, which can sometimes contain small black specks. This is part of the healing process and is related to any substances that were applied during the exam. To support your healing and reduce the risk of infection, it is advisable to avoid vaginal intercourse. The use of tampons or menstrual cups, swimming, douching, and vaginal medications or creams for at least a few days after the colposcopy. If treatment was performed, it is best to extend this avoidance for up to 4 weeks. However, it is important to know when to contact your healthcare provider. If you experience heavy bleeding that requires changing a large sanitary pad every 2 hours or more, or if the bleeding is heavier than a normal period, you should seek medical advice. Other concerning symptoms include passing large blood clots, severe or increasing pain not relieved by over-the-counter painkillers, fever or signs of infection, foul-smelling vaginal discharge, or symptoms like lightheadedness or unusual weakness. In summary, mild bleeding and cramping after cervical screening through colposcopy are expected and part of the normal healing process. These symptoms typically resolve on their own, but if you notice persistent, heavy, or worsening symptoms, it is essential to consult your healthcare provider. This aligns with established medical guidelines for cervical cancer screening and follow-up care, ensuring your safety and promoting early detection of any cervical abnormalities. Always remember to seek personalized medical advice for your specific situation.